Her name is Ushi. She is 103 years old. She lives on the island of Okinawa, off the southern coast of Japan. And every single morning, before most of us have finished our first cup of coffee, she walks to her garden, lowers herself down to the ground with her bare hands in the soil, and then pushes herself back up. She does that somewhere between 30 and 40 times before noon, not as exercise, just as life. When researchers first arrived in Okinawa, they came to study what these women were eating. They expected to find some unusual food, some rare herb, some secret in the soil. What they found instead was something far simpler and far more powerful. They left studying her legs. Because the thing Ushi does every single day, lower down, push back up, and entirely under her own power, turned out to be one of the strongest predictors of how long a person lives that science has ever measured. A doctor in Brazil took that exact movement and turned it into a medical test. What he found shocked the establishment. We'll get to that in a moment. Here is a number that should stop you cold. When researchers asked older adults what they feared most about aging, loss of independence came in first, not death. Independence. 26% of seniors said losing their independence was their greatest fear. Only 3% said death. Think about what that actually means. We are more afraid of needing someone to help us get dressed, to drive us places, to get us off the toilet in the morning, than we are of dying. And that fear is not irrational. The numbers justify it completely. By age 85, roughly half of all adults need daily help with basic tasks. Half. And when researchers asked adults over 65 whether they would choose a shorter independent life over a longer dependent one, 78% said they would take shorter. They would rather have less time than lose control of how they spend it. So the real question was never, how do I live longer? The real question is, how do I stay me? Now here is where it gets biological. Because the answer lives in your muscles. Specifically, in muscles most people never think about until they're gone. Starting around age 50, your body begins losing muscle at roughly 1% per year. By 80, you may have lost up to half of what you had at your peak. Doctors call this sarcopenia, and it is not about appearance, it is about function. The muscles we are talking about are the quadriceps at the front of your thighs, the hamstrings at the back, the glutes, the core. These are the muscles that get you up from a low chair, that keep you upright when the sidewalk is uneven, that let you carry groceries from the car to the kitchen, that catch you when you stumble on the stairs. They are not vanity muscles, they are independence muscles. And here is the thing about the Okinawan women. They never lost these muscles, because their floor had no chairs. Every time they wanted to eat, to rest, to talk, they went down to the floor and came back up again. 30 times a day, 50 times, sometimes 100. Not as a workout, just as Tuesday. That daily pattern, repeated for decades, kept the exact muscles that determine whether you stay in your home or leave it. Before we get to the exercise that replicates this, you need to understand the test that proved, in clinical terms, why these muscles are literally a matter of life and death. Because what a Brazilian physician discovered in 2012 changed how researchers think about aging entirely. In 2012, a Brazilian physician named Dr. Claudio Gil Araújo developed one of the simplest medical tests ever created. No machines, no lab work, no electrodes. He asked his patients to sit down on the floor and then stand back up, without using their hands, without using their knees, without grabbing a wall or a chair or anything at all. He scored it out of 10. 5 points for getting down, 5 points for getting back up. Every time someone used a hand for support, he subtracted a point. Every time a knee touched the floor for balance, he subtracted a point. Clean movement, full score. Compensations cost you. Then he tracked over 2,000 people between the ages of 51 and 80 for more than 6 years. He wanted to know whether the score predicted anything meaningful. What he found was not subtle. People who scored in the lowest range, 0 to 3 out of 10, were 5 to 6 times more likely to die during the study than those who scored 8 to 10. Not slightly more likely. 5 to 6 times. And every single point of improvement on that test was associated with a 21% better chance of survival. 1 point. 21%. A follow-up study published in 2025 expanded this to over 4,000 people and tracked them for 12 years. The numbers got even sharper. The lowest scorers had nearly 4 times the risk of dying from any cause, and 6 times the risk of dying from cardiovascular disease specifically. 6 times. Now, you might be wondering why one simple movement tells you so much. Here is the mechanism. The sitting-rising test does not measure just one thing. It measures 5 things simultaneously: muscle power, strength, flexibility, balance, body composition, all 5 in a single motion. Researchers call the combination your functional age. And your functional age, it turns out, is a stronger predictor of how long you will live than the number on your birth certificate. The lead researcher put it plainly. He said some people run a good marathon but cannot lace their own shoes. Cardiovascular fitness and functional fitness are not the same thing, and as we get older, it is functional fitness that decides how we actually live. Here is where this connects directly to the wall sit. The wall sit trains every single component the sitting-rising test measures: quad strength, glute activation, core stability, lower body endurance. It is, in effect, training for the test that predicts your lifespan. Except you are doing it with your back safely against a wall, which means no balance risk, no impact, and no getting stuck on the floor trying to figure out how to get back up. If you took that test right now and did not score well, the wall sit is how you change the number. But here is the thing. The sitting-rising test tells you where you stand today. What we are about to cover next tells you what this exercise actually does inside your body over time. And the finding that came out of a British research lab in 2023 is what turned the medical community's understanding of exercise upside down. Because it turns out the exercise that requires you to stay completely still outperformed every other form of exercise they tested, including running, including cycling, including everything. Now, let's talk about blood pressure, because this is where the research stops being interesting and starts being urgent. If you are over 65, there is roughly a 75% chance you are already dealing with high blood pressure, 3 out of 4 people your age, and if your doctor has prescribed you medication for it, you already know there is a cost to taking it. Blood pressure medications cause dizziness in up to 30% of patients. Not occasionally, routinely. And that dizziness is not just uncomfortable. It is dangerous in a way that most doctors do not say out loud clearly enough, because dizziness leads to falls. And for women over 65, falls are the #1 cause of injury-related death. So here is the situation. The pill that is supposed to protect your heart makes you dizzy. The dizziness causes a fall. The fall ends your independence. Sometimes permanently. That is not a rare outcome. 1 in 4 older adults falls every year. And once you have had one fall, your chance of having another one doubles. It is a cycle that, once it starts, is extremely hard to stop. This is the gap that the 2023 research walked straight into. Researchers from Canterbury Christ Church University and the University of Leicester published a landmark study in the British Journal of Sports Medicine. They pulled together 270 randomized controlled trials, nearly 16,000 people, more than 30 years of data. And they asked a straightforward question: which type of exercise is actually best at lowering blood pressure? They tested everything: walking, running, cycling, weight training, high-intensity interval training, and isometric exercises, movements where your muscles contract hard and hold still, like the wall sit. The result was not close. Isometric exercise was the single most effective intervention for lowering blood pressure, not among exercise types. Among all of them, it outperformed walking, it outperformed running, it outperformed cycling, it outperformed every form of resistance training. And isometric exercises as a category were nearly twice as effective as the cardiovascular workouts, the jogging, the biking, the brisk walking. that doctors have been recommending for decades. The wall sit specifically brought systolic blood pressure down by roughly 10 points and diastolic by roughly 5 points. Your doctor would recognize that reduction immediately. It is comparable to what a first-line blood pressure medication achieves. One exercise, no pharmacy, no copay, no dizziness. The researchers were so struck by this that they formally called for a review of current exercise guidelines for blood pressure. The official medical advice, the advice telling you to walk more, keep your heart rate up, get your cardio in, may need to change. Because the exercise that requires you to be completely still beat all of it. Now here is why it works. When you hold a wall sit, your muscles contract and squeeze the blood vessels running through them. That squeezing temporarily restricts blood flow. When you release the hold and stand back up, blood surges back through those vessels. That squeeze, then release. Squeeze, then release. Repeated across several holds in a session. Over time, that pattern trains your blood vessels to be more elastic, more responsive. Your heart does not have to push as hard to move blood through your body. The resting pressure drops, not because of a chemical blocking a pathway, because your vessels actually got better at their job. The research protocol that produced these results used 3 sessions per week, 4 holds per session. Holds lasting up to 2 minutes each, with 1 to 2 minutes of rest in between. The total weekly time commitment, including rest, is under 45 minutes. The actual time your muscles are working is closer to 24 minutes per week. 24 minutes. Results comparable to medication. No side effects, no dizziness. That is not a biohack. That is not a wellness trend. That is a documented biological mechanism backed by 30 years of data and 16,000 people. And what it does for your blood pressure is only half the story. Because the other half, what it does for the muscles that decide whether you stay in your home, is what we are getting to right now. Let's talk about what is actually at stake here. Because blood pressure is one thing, but there is a specific injury that ends independence for more older women than almost anything else, and the wall sit addresses the muscles that prevent it directly. 1 in 3 women will sustain a hip fracture in their lifetime. 1 in 3. And when that happens, the numbers that follow are sobering. Between 20 and 30% of elderly hip fracture patients die within 1 year of the injury. Half never return to the level of function they had before. 1 in 4 end up in long-term nursing home care. A broken hip is not just a broken bone. For many women, it is the event that ends the chapter, the one that means leaving the home they have lived in for decades, handing over decisions to someone else, needing help with things they have done alone their entire adult lives. It is the injury that turns the fear we talked about at the beginning of this video into reality. And in the vast majority of cases, it starts with a fall, a stumble on a rug, a misstep off a curb, a moment where the legs did not respond fast enough, or the core did not stabilize in time, or the muscles simply did not have the power to catch what was falling. The wall sit targets the exact muscles that stop that chain from starting. The quadriceps at the front of your thighs, the hamstrings at the back, the glutes, the deep core stabilizers. These are not gym muscles. These are the muscles that fire the instant your foot lands wrong, the muscles that absorb the shock of an uneven step before it reaches your hip, the muscles that get you out of bed in the morning without grabbing the headboard. Now here is the part that matters for anyone who has avoided leg exercise because of knee pain. Because that is one of the most common reasons people stop moving. And it is one of the most common reasons things get worse. Because the wall sit is isometric, your joint stays still while your muscles work. There is no bending and straightening, no grinding, no impact. A meta-analysis of 9 studies involving nearly 700 people with knee osteoarthritis found that isometric exercise significantly reduced pain, improved physical function, and increased muscle strength, without worsening the joint. That is the critical insight. The wall sit lets you build the strength that protects your knees without the repeated motion that irritates them. You are loading the muscles, not the cartilage. And researchers found something else that nobody expected. When people performed wall sits, their pain thresholds rose throughout their entire body, not just in the legs. At the calf, at the forearm, at the lower back. The exercise appears to trigger a system-wide pain relief response, something researchers believe is linked to the body's natural pain-regulating mechanisms being activated under sustained muscular load. So the woman who says her back hurts, her knees hurt, she just hurts. She is the exact person this exercise was built for. Every wall sit you do is a deposit. Researchers call it building your functional reserve, the gap between what your body can handle and what daily life demands of it. The bigger that gap, the more room you have before a bad day becomes a crisis. Here's the good news: you do not need a gym. You do not need equipment. You do not need shoes or special clothes or a class or a coach. You need one wall. That is the entire setup. Stand with your back flat against the wall. Place your feet about 2 feet out from the base, hip width apart. Then slowly slide your back down the wall by bending your knees. You do not need to go low. Even a small bend, just enough to feel your thighs start to work, is enough to begin. The angle does not matter as much as the consistency. Hold that position and breathe. Breathe normally. In through the nose, out through the mouth. This is the most common mistake people make with this exercise. They hold their breath during the hold. Do not do that. Holding your breath temporarily spikes blood pressure, which is the exact opposite of what we are trying to achieve here. Like, breathe through the whole thing. If you are just starting out, aim for a 20 to 30 second hold. Then stand back up, rest for 1 to 2 minutes, and do it again. 4 holds total per session, 3 sessions per week. That is the frequency the research used. Not every day, not twice a day, 3 times a week. Keep a sturdy chair within arm's reach your first few sessions, just in case. Make sure your knees stay above your ankles. Never let them drift forward past your toes. Keep your back pressed against the wall the entire time. And if your knees hurt at any depth, go shallower. A smaller bend with no pain will do more for you than a deeper bend that makes you stop. As you get stronger, and this will happen faster than you expect, you slide a little lower. Hold a little longer. The research protocols used holds of up to 2 minutes each. You do not need to start there. You just need to start. One thing to be clear about: if you are on blood pressure medication or managing a cardiovascular condition, tell your doctor you are adding this to your routine. Not because there is reason for concern, the research strongly supports it, but because if your blood pressure begins to drop, your doctor may need to adjust your medication. That is a good problem to have, but your doctor should be part of that conversation.